Welcome to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Cooper Smith, a doctorate prepared nurse practitioner, and this show is about empowering you to live a radiant, healthy, and balanced life.
Mm.
I'm very excited to introduce today's guest, Dr. Alicia Newsome, functional medicine practitioner and owner of the Body Wellness Institute. She is the author of Worthy of Rest and the podcast host of the Whole and Complete Woman. So, welcome. Thank you so much for being here today.
Thank you so much for having me.
Yeah, I'm really excited to talk with you about personalized medicine and what inspired you to go into that line of practice.
Well, it really started with my own journey, as same with many other people. So, over 10 years ago, I was going through a divorce, leaving a very volatile marriage, and I was tired all the time. So, Sunday afternoon, you could easily find me after church at a friend's house, asleep on the couch. And I had two little ones, they would be running around, and I was just asleep. I was tired all the time. And it wasn't just on Sundays, it was Monday, Tuesday, Wednesday. I was just trying to see patients and finish my day so that I could go to sleep. I was so tired. And I had neck pain and back pain and all these different health issues as well. And I ended up meeting a functional medicine doctor who really just taught me and ran lab tests on me and helped me understand what was going on with my body. I was doing lots of things like supplements and detoxes and things like that, but we really got to the root cause of my issues. And from there, my energy went up. Felt so much better in my body. I used to have really bad periods as well too, so those regulated, and that's what really started me on my journey of personalized medicine.
Oh, wonderful. I think having that experience just helps us be more passionate about it and you know what it feels like to be in that situation.
Yeah, I do. So when women come to me, I'm very empathetic because I know what it's like. I know what it's like to have things that you want to get done and your purpose and your passion, but your health is holding you
Mm.
back from really being able to accomplish those things.
Yeah, so you were under some pretty extreme stress.
Yeah.
Um, do you think that that was a contributor to your symptoms?
Stress is a big contributor to symptoms, and I really look at it under uh, multiple ways, really. There's always the mental and emotional stress. So, life is going to life, right? There's always going to be things going on. We may be dealing with things at work or relationships, all of that. But there's other stressors that go on as well underneath the surface. So, you could be dealing with toxins. So, biotoxins, those are living things like mold, fungus, parasites, and there's external toxins. And then there's deficiencies in your body, like not getting enough protein, not getting enough sleep, gut issues. The body still interprets all of those as stress. So, to answer your question, yes, stress, but for me, stress is a much wider area that I look at versus just the mental and emotional part, which is very important.
Uh, so finding that root cause. So what does that process look like?
So for me, when clients are working with me, I do a very extensive intake. So my initial consultations with clients, they're 90 minutes. So we're really looking at their intake form. And there are all types of questions where people are like, no doctor has ever even asked me these
Mm.
questions. So we're looking at, what was your birth process like? Where did you grow up? What's going on in your life currently? Like all these different facets that make us human beings. We're looking at those things. And then I'm a big advocate of testing. So test, don't guess. There's a lot of advanced testing out there that we can really find out exactly what's going on inside the body. So between that, the actual lab test, and then the assessments that I do during my intake process, that's how we get to the root cause of issues.
Wonderful. How long does it take to get all of that data and to figure it out and come up with a plan?
It can be rather quick. So, really just completing your intake forms, doing that process, and then the labs really vary. So, depending on what's going on with someone, I'll recommend different labs. Some labs come back very quick in just a week, and we're able to get that information back. And then some people, we may do something called cycle mapping when it comes to their menstrual cycle. So, your periods, they change throughout the month, right? So estrogen goes up and then it comes back down, and then progesterone goes up and it comes back down. And if we just do one single blood test with that, then we just know what those hormones were doing that day. So with some people, we may opt to do something called cycle mapping, where we're looking at that throughout the month. We're gathering lots and lots of data, getting a full picture of what's going on. So that takes longer. And then we wait for those results to come back. Normally takes about 2 weeks. So it varies depending on what the person's needs are. But once we have that information, we have a very clear picture of what's going on with someone. And then we can move into helping them resolve those issues.
Mm. So you mentioned some of the female hormones.
Mhm.
Do you check cortisol levels as well?
Yes.
Yeah.
Cortisol is actually my favorite. I look at progesterone and estrogen. Those are the popular ones everyone knows about, but they're really responding to other things that's going on inside of the body. So cortisol is like the king hormone or the queen hormone that I look at, along with insulin. That's a very important one as
Oh.
well too, that people often overlook. But cortisol is your stress hormone. So we're able to look at that throughout the day, see what's going on, how your body's responding to stress, how your body's metabolizing cortisol, and then use that information to make very precise treatment plans for people.
So you mentioned earlier that we have the emotional stress that people can relate to, but also the internal stress. Is that affecting our cortisol as well?
Oh yes. So your our bodies were created to deal with stress short term. Stress in and of itself is not a bad thing. So when you think about a bear coming after you, and what you would do is you would eliminate that bear, all right? You're either going to run and get away, or you're going to fight and kill the bear off, right? You're going to do something to save yourself. And then once that's done, then your stress levels, you go back down. You're no longer in this fight or flight mode. You move into what we call a parasympathetic state, which is rest and digest. But what goes on is that we stay in these stressed out states, and it can be due to any of those things. It can be the mental, emotional state, and then also the toxins and deficiencies as well too. And my goal with women is, of course, we're going to remove the source of stress, whether that's the toxins or you need to eat more, sleep, those types of things, and then mental, emotional stress. But the goal is really to widen your zone of stress resiliency. Because like I said, life is still going to life. You're still going to be exposed to different toxins and things in the environment that stress the body out at a physiological level. But what we want is to increase that zone. So I look at it as, let's say that you're going white river rafting, which I actually don't enjoy. I went once, it was very scary for
Scary.
me. But think about, you're going down this river and then you're like bumping up against these walls, right? Like that stress and life's happening. What we want to do is we want to widen your body's ability to adapt and handle stress, so that when life is still happening and you're still exposed to different things that stress your body out at a physiological level, your body's better able to respond to that.
Mm. So in our current state, let's say we haven't done that work yet and we have that chronic stress. What does that do to our other hormones?
So there is your stress hormone, so cortisol,
Okay.
right? And progesterone and estrogen are the ones, we hear most often about, but they really get impacted when our body's under this great amount of stress. Because think about it, if a bear was coming after you, the last thing your body would say is, well, now's a good time to make a baby, right? It's not going to do that.
No.
It's going to say, okay, we've got to shunt, glucose to her legs so she can run, all of these different things. It's focused on survival. So when your body is in this constant state of survival, it's going to impact those downstream hormones, progesterone, estrogen, testosterone, and the body's going to say, we don't need those right now. We're focused on survival. So a lot of times women can have lower levels. They can deal with menstrual cycle issues like I did, infertility, all of these things, because the body is like, nope, we can't give you progesterone right now. We're trying to save you, and you're in this fight or flight mode right now.
Yeah, I had experienced that as a younger woman. I was an ICU nurse, and we were trying to get pregnant and couldn't, and they did all these tests and nothing's wrong. We don't understand. And then it wasn't until later when I was doing something a lot less stressful that my body did allow us to have a baby. But
Yes,
oh,
congratulations.
that was a long time ago. She's not a baby anymore. but but yes, that was a very interesting time. And you do, like, when you experience it, you're like, oh, that stress, that's my body protecting me and
Hmm.
not allowing this at this time.
Yep. Yeah, our bodies are very wise. They're smart.
Mhm. So you mentioned toxins as a source of stress. What kind of toxins are you seeing?
So, toxins are broken down into two different categories. There's biotoxins, those are living things like mold, fungus,
Mm.
parasites, bacteria, um, viruses. So, even think candida inside
Yeah.
in the body. And then there's also external toxins. So external toxins are going to be things that could come from medications that have, side effects.
Yeah.
All are toxic to our body. They all have different uses. But there's things that affect our body. There are pesticides that are sprayed into our foods. There's radiation. There's all types of other external toxins that our body gets exposed to that stresses our body out physiologically.
Yeah, we've done a couple shows on that, and just there's so much environmental stuff that we're exposed to that really is disrupting our health on so many levels.
I was reading recently that there was research done that the amount of microplastics that we take
Yeah.
in is equivalent to a credit card
Oh,
weekly that we're taking in. Yeah. So it's really impactful on our health.
is that from packaging and foods and things like that?
Yes, packaging in foods or, water bottles. It's everywhere.
Mm. Yeah, I think bottled water, of course, is very popular, and people think because they're worried maybe about the water coming out of the tap that it has stuff in it, but then they're actually getting a different type of toxin.
Toxin. Yep.
Yeah.
Little exchange happening there.
Mm, man. So you mentioned earlier gut health. What are you
Hmm.
seeing in terms of people's guts? What's going on?
Well, a lot of times the women that I work with, they're not able to poop.
Yeah.
So there's issues going on with constipation. And the way that that impacts your hormones is that estrogen goes up and then it comes down, but it's got to be able to leave the body.
Mm,
There's different markers that we can look at in the gut. Beta glucuronidase is one of them, but where it's estrogen gets reabsorbed into the in the gut and goes back into the bloodstream, which can create estrogen dominant for some women. Then there's bloating, there's diarrhea, there's food sensitivities that people can have. So the gut should be nice and sealed, nice and tight. But when there's issues there, then whole food particles can seep into the bloodstream and the body
mm,
says, "Whoa, these aren't supposed to be here. I'm not supposed to see broccoli here or asparagus or raspberries, anything like that." So sometimes people are eating foods that are generally thought of to be healthy, but their body in that time is responding negatively to it.
yeah. Are you seeing a lot more food sensitivities these days?
I can't say I'm seeing more. I would say that most people have them or have issues with them.
Yeah. So I think that's a big part of the workup too, is figuring out what you're like you mentioned broccoli. Like, of course I should have broccoli. Well, not you, Amy, you know.
Yeah.
Yeah. But
Yeah.
all right, so I'm going to have you hold that thought. We're going to pause for a break from our sponsor. You're listening to Energize and Revitalize with Dr. Amy. Don't go anywhere. We'll be right back. Welcome back to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Cooper Smith, and my guest today is Dr. Alicia Newsome. Before the break, we were talking about all kinds of things that can cause stress in the body, whether emotional or physical. And we're going to talk about that a little more, and then we're going to talk about what to do about it. So during our break, you and I were chatting about autoimmune conditions. So are you seeing a lot of that among your clients?
A lot of times, clients can have things like Hashimoto's,
Yeah.
where the body starts to attack itself. Really, autoimmune is just different parts of the body where the body is now seeing that organ or that part of the body as an invader, like something where the immune system starts to attack it and is like, you're not supposed to be here. So yeah, I do see them in my practice. Typically, there's women dealing with Hashimoto's. I do see a lot of women that come in that have lupus as well too. And then there's also Crohn's in the gut. And there's rheumatoid. I mean, it's so interesting too to see like how the body starts attacking itself, and it's so different for different people. But there are some underlying themes that I do see between all the different autoimmune diseases.
Oh yeah. So, to our listeners, autoimmune is the body's attacking itself. The immune system kind of gets confused and attacks the wrong things.
Yeah.
Um, so do you think that stress is a major cause of that, or is it other things, or everything we've been talking about so far?
A lot of what we've been talking about, and one of the underlying themes that I see with autoimmune disease is typically there's something that triggered it and set it off in a woman's life. So it could be a major event. Like anytime I always ask whenever they get the diagnosis or the symptoms really began to come up, I'm like, was there anything going on in your life during this time? Anything that's major, where there was a big transition in your life, a divorce, something going on with your kids. And typically that situation was something that was a tipping point for that woman. And I say tipping point because usually she was already had just some underlying symptoms, underlying stressors that her body had been dealing with. So maybe she was dealing with parasites or mold that was just kind of lurking there below the surface, candida. Maybe she's had some gut issues going on. She's not sleeping well at night. All of those different types of things that are already stressing the body out. And of course, we know that stress, it impacts the adrenals, it sends them into overdrive, but that impacts the immune system as well. So typically what I see is basically this perfect storm that happens where now they've been dealing with toxins, and then they've been dealing with sleep issues or gut, not eating enough protein, those different types of things. And then there's a big stressor that comes, and that just sends the body into overdrive.
Yep. So that kind of leads us back to, you had mentioned earlier about stress resilience and becoming better at that. How do we do that?
So I grew up in a home that my emotions were something that was just don't have them, like be happy. And that's
Or
pretty
else?
much like, yes, that's the only emotion. My mom just didn't have the tools, and she didn't understand how to deal with like any kind of pain or sadness or anger or anything that came up for me. So I grew up very much stuffing all of those emotions as they would happen. So a big part of my practice is working with women around their emotional regulation and what comes up for them. Because we can't, I think we've talked about before, the body keeps score, right? Like we can't just ignore all the things that happen in life and just keep pushing through. And I know oftentimes as like high achieving, ambitious women, we
try.
go,
Yeah.
yeah, we go, and we're good at like, no, I'm gonna push through. Things don't really knock me down. I'm gonna keep going, and I'm gonna achieve. I'm gonna hit my goals. So one thing is to really be able to be with what comes up. So I teach a practice of just when something happens, and it can be small things, but our body's always talking to us, and even inside our emotions as well. So things may happen, and inside, typically we default to one of four ways of being, where we might feel like I'm not safe. We might feel like I don't belong or I'm not wanted. We might default to I'm not enough, right? But in order to get there, we have to first acknowledge, like, how are we feeling, right? Like, I'm feeling sad, and really be with that emotion that we're feeling. So I teach that, like, first, let's stop and identify, like, what's coming up? How do you feel? And be with that. And then also just being able to reflect back, almost like mother ourselves. So when if my daughter came to me right now and something happened at school where she felt rejected or she was fearful or nervous and she came to me, I wouldn't just blow it off and be like, okay, you're fine, right?
Of
I would
course. Yeah.
I would want to be with what she's saying and like acknowledge, like, I see that you're sad, right? And then I would also tell her the truth. I'd ask her, what are you feeling? Like, well, I'm scared. I'm scared to give my presentation at school, right? And I can acknowledge that and be with that. Like, I see that you're scared, right? And then remind her of the truth of who she is. So, and that may be like, you are powerful and, you are so gifted, whatever it is that she might be needing in the moment, I give that to her. But then we have to come back and give that to ourselves too when things come up for us. So I really teach that. And they say that if you're just with an emotion for, I think, 60 seconds, it might be 90, don't quote me on that. But if we just allow ourselves to be with that, whether it's sadness or anger, that it tends to dissipate. Like, where it's just, and they say emotions, like it's their energy in motion, right? Like we just have to acknowledge what's happening there. And so that's a big part of the work that I do with women. And consequently, that allows us to move more powerfully through life, and to regulate our emotions, not stuff them, not have us explode on our spouses later because we've allowed all these things to build up, which then impacts our relationships and our work and how we show up everywhere else too, decreasing our stress.
Yeah, and it takes a lot of work to get out of the habit of suppressing, because
Yes.
we do it. and
Mm-hmm.
but suppressed emotions do have a way of rearing their ugly little heads when you don't want them to. So
Yes.
so you're absolutely right in doing the work now so that you can have a healthier tomorrow.
Yeah.
So that's really important. So you address the emotions, which
Mm-hmm.
I think we're learning that that's probably the most important thing because so much else is controlled by that or affected by that.
Yeah.
But earlier in the show, you had mentioned testing and supplements.
Oh,
So
yes.
are you able to take all of the data you've gathered and kind of personalize someone's regimen?
Oh, yes. Yes, yes, yes. So really, with the data that we get back there, we really customize and personalize things from what supplements you need to be taking to how you need to be eating with your food, what kind of exercises you need to be doing, what lifestyle routines you need to implement. And you're right, it takes a lot of work to deal with the emotions, but there's very practical things that I do with my
Mm,
clients on just even with what's going on with their cortisol and what they may need to do morning and evening routines,
mm,
to reset their circadian rhythms or to bring down their stress levels, that are very simple tools. Like, so one thing that's huge is brain dumping in the evening, like literally. And I know it sounds sometimes like a chore, like journaling or things like that. It's very simple. Even if you say, I'm going to write for 1 minute and just
mm.
put everything that's in my brain onto a piece of paper so that I can go to bed tonight and not have that kind of running through my mind. Right. So I always recommend brain dumping 5 minutes before bed. You can start with one. Sometimes our brain needs a simpler thing, like, okay, I can go to the gym for 2 minutes, right? Knowing
Exactly.
once I get there, then I'll do more,
Yeah.
right? So brain dumping at night is a big one that I recommend. That's very practical and like can really help decrease stress as well. But all of that is personalized based on what's going on with someone's cortisol and what they
Mhm.
need, as well as their other lab testing.
What do you do in the morning?
So in the morning, I'm a big advocate of gratitude, and not just like writing down, like I'm thankful for my husband, which I am, or, my children. I believe in really feeling what that feels like. So when I think about my son, he's 2. And I just think about how grateful he is, or well, he is grateful. He's a very happy kid, but how grateful I am.
Yes.
And I literally allow myself to feel that emotion. So,
Mm,
like, I'm so thankful for his hugs and cuddles, and I allow myself to feel that. And some days it may be hard to, find something, and it may just be like, I'm thankful for the sun hitting my skin right now, you know? And really allowing myself to feel that, like the rays of sunshine, just thank you. So I allow myself to, I do 5 of those in the morning. And that really sets the intention for my day, along with I set a goal for myself, one for my work and then one for my family as well too. And that really reminds me and keeps me focused and um, changes the trajectory of my day, because I can tell a difference on the days that I don't do it and I get up and I go versus when I implement this very important practice.
Yeah, and that's such it. Those things don't take a lot of time, so
Mm-mm.
those are things that people can do starting today. We can go ahead and start taking care of ourselves.
Or even in the car, like
Oh,
not even saying, well, let me start tomorrow. Like I can just start right now, like in this
mm,
moment, say, what am I grateful for?
yeah, fabulous. So we're running out of time, but you have some exciting things coming up.
I do. So we have the All Things Women Summit that's coming up. And you just can go to allthingswomensummit.com. And then I'm releasing my book in May. It is called Worthy of Rest. And it's a book for the woman who's tired of being the strong one. We live in a culture that worships exhaustion. And this book is written specifically for the women that need some rest.
Oh, I love that. So we'll watch for that, and we'll put the link to your summit on our show notes, and hopefully people will join and just start taking care of themselves.
Absolutely.
Right, well, thank you again for being here.
Thank you so much for having me today. I appreciate it. And it's been a good conversation.
Yes. And thanks to our listeners for tuning in to Energize and Revitalize with Dr. Amy. Are there topics you would like to hear about? Please send an email to radiantpodcast2025@gmail.com. Check out past episodes on our YouTube channel. And we're also featured on Apple Podcasts. I'll be back next Saturday morning at 7:30 with more expert insights and practical strategies to help you live a healthy and radiant life. Until then, here's to your best life.